What I'm about to share with you might sound too good to be true, but stay with me because the science behind this is solid and the results I've seen in my own practice are nothing short of remarkable. There's a reason why elderly Chinese men maintain sexual function well into their 80s and even 90s, while Western men often struggle starting in their 50s and 60s. And it's not genetics. It's not luck. It's a simple daily practice that's been used in traditional Chinese medicine for over 2,000 years and is now being validated by modern scientific research. I'm Dr. Madison Li, board-certified urologist with over 12 years of experience, and today I'm revealing a protocol that combines ancient wisdom with cutting-edge science. A protocol so effective that when I first learned about it during my research into longevity and sexual health, I was skeptical. But then I started recommending it to patients who had tried everything else, and the results were undeniable. Men in their 70s and 80s reporting morning erections they hadn't experienced in decades. Firmness returning. Confidence rebuilding. And the best part? This doesn't require expensive supplements, dangerous medications, or complicated routines. This is something you can start today using ingredients you probably already have in your kitchen. But here's what you need to understand. This isn't a quick fix. This is about restoring the foundational systems in your body that control blood flow, hormone production, and cellular health. When you do this correctly, consistently, the changes aren't just in your erections. Your entire body responds. Energy increases. Mental clarity improves. You feel younger from the inside out. Stay until the end because I'm going to give you the exact protocol, the specific timing, the ingredients you need, and most importantly, the common mistakes that will make this completely ineffective if you get them wrong. Let me start by telling you about David. He's 73 years old. When he came to my office, he was frustrated and embarrassed. He told me he hadn't had a reliable erection in over 5 years. He'd tried Viagra. It worked sometimes but gave him headaches and made him feel disconnected from the experience. He tried Cialis. Better, but still inconsistent. His wife was patient and understanding, but he felt like he was failing her. We ran his blood work. Testosterone was low but not critically low. Blood sugar was slightly elevated. Blood pressure was being managed with medication. Nothing screamed obvious problem, but everything was slightly off. He was like so many men his age, slowly declining across multiple systems. I asked him about his diet. Typical American diet. Processed foods, not much variety, eating out frequently. I asked about his morning routine. Coffee, quick breakfast, straight to his day. No real structure. That's when I introduced him to what I call the Chinese Vitality Protocol. It's based on traditional Chinese medicine principles but backed by modern research on nitric oxide, inflammation, and cellular health. I gave him specific instructions. Specific ingredients. Specific timing. 6 weeks later, David came back for follow-up. He looked different. More energy in his movements. Better color in his face. And before I could even ask, he smiled and said, "Doc, it's working. I'm waking up with erections like I'm 50 again. My wife can't believe it. I can't believe it." That was 2 years ago. David still follows this protocol every single day. He's 75 now and his sexual function is better than it was at 70. So what is this protocol? What are Chinese men doing that's so effective? Let me explain the science first, then I'll give you the exact steps. Traditional Chinese medicine has always understood something that Western medicine is only recently accepting. Sexual health is not isolated. It's a reflection of your overall vitality, your circulation, your hormone balance, your inflammation levels, and your cellular energy production. In Chinese medicine, sexual dysfunction is viewed as a deficiency in what they call kidney yang. Now, this isn't about your actual kidneys, though kidney health is part of it. Kidney yang represents the body's vital energy, warmth, circulation, and reproductive capacity. When kidney yang is deficient, you experience cold hands and feet, low energy, poor circulation, reduced libido, and weak erections. Sound familiar? That's what happens to most Western men as they age. But here's the key insight from Chinese medicine: kidney yang can be restored. It's not gone, it's just depleted. And you restore it through specific foods, specific herbs, specific practices, and specific timing. Modern science now understands the mechanisms behind what Chinese medicine observed thousands of years ago. What they called kidney yang deficiency, we now understand as reduced nitric oxide production. Nitric oxide is the master molecule that relaxes blood vessels and allows erections. After 50, production drops by up to 50%. Chronic low-grade inflammation. Inflammation damages blood vessels, reduces hormone production, and interferes with nerve signaling. Mitochondrial dysfunction. Your cells produce less energy, everything slows down, including sexual function. Hormonal imbalance. Not just testosterone, but also DHEA, pregnenolone, and other hormones that decline with age. The Chinese Vitality Protocol addresses all four of these simultaneously. That's why it works when single-mechanism solutions like Viagra don't provide lasting results. Now let me reveal the core components of this protocol. Component 1, the morning tonic. This is consumed every single morning, 30 minutes before breakfast, on an empty stomach. The ingredients are specific and the order matters. Start with 8 ounces of warm water. Not hot, not cold. Warm. About 110 degrees Fahrenheit. Warm water supports circulation and prepares your digestive system. Add 1 tablespoon of raw honey. Raw, unprocessed honey contains enzymes, antioxidants, and compounds that support testosterone production. Studies show raw honey increases serum testosterone and supports testicular health. Add 1/2 teaspoon of Ceylon cinnamon. Not regular cinnamon, Ceylon cinnamon. It's critical. Ceylon cinnamon improves insulin sensitivity, reduces inflammation, and increases blood flow. It's been shown in studies to improve erectile function in men with metabolic syndrome. Add 1/4 teaspoon of ginger powder or 1 inch of fresh grated ginger. Ginger is a powerful anti-inflammatory and circulation booster. It increases nitric oxide production and supports cardiovascular health. Add the juice of half a lemon. Fresh squeezed. The vitamin C supports collagen production in blood vessels and enhances nitric oxide bioavailability. Optional but recommended, add 1/4 teaspoon of Korean red ginseng powder. Korean red ginseng has been clinically proven to improve erectile function. A meta-analysis of multiple studies found significant improvements in erectile function scores compared to placebo. Mix this all together and drink it slowly over 10 to 15 minutes. Let it warm your body from the inside. This is not just a drink. This is medicine. What's happening physiologically? The honey provides quick energy and supports hormone production. The cinnamon reduces inflammation and improves insulin sensitivity. The ginger increases circulation and nitric oxide. The lemon provides antioxidants and supports vascular health. The ginseng directly improves erectile tissue function. Together, these ingredients create a synergistic effect that's far more powerful than any single ingredient alone. Component 2, the circulation practice. This is done immediately after drinking the morning tonic, while the ingredients are being absorbed. Stand with your feet shoulder width apart. Place your hands on your lower back, right over your kidneys. Rub briskly in circular motions for 2 minutes. This generates heat and stimulates kidney function according to Chinese medicine. Modern science understands this as improving blood flow to the adrenal glands and kidneys, supporting hormone production. Next, perform 50 deep squats. Full range of motion if possible. Squats increase blood flow to the pelvic region, stimulate testosterone production, and strengthen the muscles involved in sexual function. After squats, do 30 Kegel exercises. Contract your pelvic floor muscles as if stopping urination midstream. Hold for 5 seconds, release for 5 seconds. Repeat 30 times. Strong pelvic floor muscles are essential for firm erections and ejaculatory control. This entire practice takes 10 minutes. 10 minutes that can transform your sexual function over the next several weeks. Component 3, the evening ritual. What you do before bed is just as important as what you do in the morning. 2 hours before bed, take a warm foot soak. Fill a basin with warm water, add Epsom salts and a few drops of lavender essential oil. Soak your feet for 15 to 20 minutes while sitting comfortably. Why? In Chinese medicine, there are powerful acupressure points in the feet connected to kidney energy and sexual function. The warm water increases circulation. The magnesium from Epsom salts absorbs through the skin and supports muscle relaxation, sleep quality, and hormone production. After the foot soak, massage the kidney 1 acupressure point. This point is located on the sole of your foot, about 1/3 of the way down from the toes, in the depression that forms when you curl your toes. Press firmly and massage in circular motions for 2 minutes on each foot. This practice calms the nervous system, improves circulation, and according to Chinese medicine, tonifies kidney yang. Modern research on acupressure shows real effects on nervous system regulation and blood flow. Component 4, the dietary principles. This isn't about strict rules. It's about emphasizing foods that support sexual vitality and minimizing foods that damage it. Foods to emphasize daily: oysters, rich in zinc, which is essential for testosterone production. Walnuts, which improve sperm quality and support vascular health. Dark leafy greens like spinach, high in nitrates that convert to nitric oxide. Pomegranate, clinically proven to improve erectile function. Fatty fish like salmon, rich in omega-3s that reduce inflammation. Eggs, especially the yolks, which provide cholesterol needed for hormone production. Garlic and onions, which boost nitric oxide production. Dark chocolate, at least 70% cacao, which improves blood flow. Foods to minimize or avoid: processed foods high in sugar and trans fats. These damage blood vessels and promote inflammation. Excessive alcohol, which suppresses testosterone and impairs erectile function. Soy products in large amounts, which can have estrogenic effects. Fried foods, which damage blood vessels and promote oxidative stress. Component 5, the sleep optimization. In Chinese medicine, sleep is when kidney yang is restored. Modern science agrees. Testosterone is produced primarily during deep sleep. Growth hormone is released during sleep. Cellular repair happens during sleep. Go to bed by 10 p.m. This aligns with natural circadian rhythms and maximizes deep sleep and REM sleep cycles. Keep your bedroom cool, 65 to 68 degrees. Keep it completely dark. Remove all screens at least 1 hour before bed. Consider wearing blue light blocking glasses in the evening. Before bed, practice 10 minutes of deep breathing. Inhale for 4 counts, hold for 4 counts, exhale for 6 counts. This activates the parasympathetic nervous system, reduces cortisol, and prepares your body for restorative sleep. Now let me tell you what to expect when you start this protocol. Ótimo. Dando continuidade a converso do roteiro. Roteiro formatido, Part 3. Week 1, you might not notice dramatic changes yet, but you should feel slightly more energy in the mornings. Your digestion may improve. Some men report better sleep quality. Week 2 to 3, this is when most men start noticing changes in sexual function. Morning erections may begin returning, even if they're not full strength yet. You might notice increased spontaneous thoughts about sex, which is a sign of improving libido. Week 4 to 6, significant improvements. Morning erections become more consistent and firmer. Ability to achieve erections improves noticeably. Energy levels are markedly better. Many men report feeling a decade younger. Week 8 and beyond, full effects. Sexual function approaching or matching levels from 10 to 20 years earlier. Sustained energy throughout the day. Better mood and mental clarity. This becomes your new normal as long as you maintain the protocol. Let me share another patient story. Robert, 68 years old. He'd been on Viagra for 3 years. It worked, but he hated feeling dependent on a pill. He wanted natural solutions. I gave him this protocol with detailed instructions. The first 2 weeks, he said he didn't notice much. I told him to keep going, trust the process. By week 4, he called me excited. He'd woken up with a firm erection for the first time in years without taking any medication. By week 8, he'd stopped taking Viagra entirely. His natural function had returned to the point where he didn't need it anymore. He told me, "I feel like my body remembered how to do this. Like you just had to remind it." That's exactly what this protocol does. It reminds your body how to function optimally by giving it the nutrients, circulation, hormonal support, and rest it needs. Now let me address common questions and potential mistakes. Mistake 1, inconsistency. This protocol only works if you do it daily. You can't do it twice a week and expect results. Your body needs consistent inputs to create lasting change. Commit to 90 days minimum. Mistake 2, using the wrong ingredients. Regular cinnamon instead of Ceylon cinnamon. Processed honey instead of raw honey. These details matter. The active compounds are different. Get the right ingredients. Mistake 3, skipping the movement practices. The morning tonic is powerful, but it's amplified by the squats and Kegels. Don't skip the physical practices. They're essential. Mistake 4, ignoring sleep. You can do everything else right, but if you're only sleeping 5 hours a night, your results will be minimal. Sleep is when your body rebuilds. Prioritize it. Mistake 5, expecting overnight results. This is not Viagra. This is rebuilding your body's natural function. It takes time. Be patient. Trust the process. Question: can I do this if I'm on medications? Most likely yes, but check with your doctor. These are food-based interventions, generally safe, but always inform your healthcare provider about changes you're making. Question: what if I don't see results after 8 weeks? Then we need to look deeper. You may have underlying issues that require medical intervention. Hormone levels might need optimization. Vascular health might need specific treatment. But give this protocol a full honest effort first. Question: can younger men do this protocol? Absolutely. Prevention is easier than reversal. Men in their 40s and 50s can use this to maintain function and prevent decline. Question: is this protocol safe long-term? Yes. These are foods and practices that support overall health. There's no downside to doing this indefinitely. Here's what I want you to understand. The reason elderly Chinese men maintain sexual function isn't because they have better genetics. It's because traditional Chinese medicine never separated sexual health from overall vitality. They understood that when you support circulation, reduce inflammation, balance hormones, and prioritize sleep, sexual function naturally follows. Western medicine tends to view erectile dysfunction as a plumbing problem. Take a pill, increase blood flow temporarily, problem solved. But that's not addressing why the blood flow was compromised in the first place. This protocol addresses the root causes. It rebuilds your body's natural capacity for firm, reliable erections. And the benefits extend far beyond the bedroom. You'll have more energy for your grandchildren. More mental clarity for your work or hobbies. Better mood and less irritability. Improved cardiovascular health that could add years to your life. Sexual function is a barometer of overall health. When it improves, everything improves. Let me give you one final story. James, 81 years old. Yes, 81. He came to me not expecting miracles. He just wanted to feel more vital, more alive. His wife had passed away 2 years prior, but he was dating again and wanted to feel confident. I gave him this protocol. I was honest that at 81, results might be modest. But James was disciplined. He followed everything exactly. 3 months later, he told me he was experiencing erectile function he hadn't had since his early 70s. He was stunned. His new partner was stunned. I was impressed but not entirely surprised because I've seen this protocol work at every age. Age is not the determining factor. The determining factor is whether your body has what it needs to function optimally. Give it the right inputs and it responds, even at 81. So here's my challenge to you. Commit to this protocol for 90 days. Write down your starting point. Rate your erectile function on a scale of 1 to 10. Track your energy levels. Track your sleep quality. Track your morning erections. Then do the protocol daily. No excuses. No skipping days. 90 days of commitment. At the end of 90 days, reassess. Rate everything again. I'm confident you'll see dramatic improvements. And when you do, come back to this video and leave a comment. Share your results. Inspire other men to take action. If this video gave you hope and a clear action plan, hit that like button. Let YouTube know this information needs to reach more men. Subscribe to this channel for more evidence-based strategies that combine ancient wisdom with modern science. I post weekly videos on men's health, longevity, and vitality. Turn on notifications so you never miss content that could change your life. Comment below and tell me, are you ready to commit to this protocol for 90 days? And if you've already tried aspects of traditional Chinese medicine for health, share your experience. Share this video with any man who's struggling with sexual function or just wants to optimize his vitality as he ages. This information is too valuable to keep to yourself. Remember, this is educational content and doesn't replace medical advice. If you have serious health conditions, work with your healthcare provider. But this protocol is based on sound principles and safe practices that support overall health. I'm Dr. Madison Li, and I'll leave you with this thought. Your body is incredibly resilient. Even after years of decline, it can rebuild, regenerate, and restore function when given what it needs. You're not broken. You're not too old. You just need the right approach. Your vitality is waiting. Your confidence is waiting. Your best years can still be ahead of you. Starting today. See you in the next video.